welcome to the Fit and Healthy Today show. And today we're going to be discussing what is homeopathy. This reason why I'm addressing this today is I had a local physician come in and basically kind of say, homeopathy, it's not something that we really address in medical science. You know, we're researching herbs and vitamins and things, but homeopathy, I thought it was very important to address this so that you have an understanding that you do have another option for medical treatment. We have our standard allopathic, we have naturopathic medicine, which is herbs and vitamins and the typical supplements. We have acupuncture, we have a lot of different other therapies. But we also have homeopathy. It's been around for over 200 years. So almost as old as this country is. And it was developed by a German physician scientist by the name of Samuel Hahnemann. He did a lot of observation and research in coming up with these homeopathic medicines in order to determine how these medicines could enable the body's own natural responses. It's kind of interesting. I wrote the principles of homeopathy and then also the conventional medicine principles because I wanted to address so that you understand there's different philosophies about how the body is treated or how illness is addressed. So when we look at homeopathy, the bottom line is the natural state of the body is health. Okay, that's what we're going to always assume, and to get or maintain that natural balanced health state is where we want to be. They believe that we possess our own natural abilities through our immune system, however, our hormone responses, all that, our own natural ability to heal ourselves. And that basically all we need to do is not suppress the symptoms, but do things to seek to stimulate the body's own natural healing processes, trying to reach that homeostasis balanced state. They focus on the patient, not the illness, and how you can get the patient back into balance. And by considering mind, body, emotional state, a lot of different factors that go into making a person out of balance. Probably the best example I could give you is when we're under a lot of stress, certain cortisol hormones are pushed, our digestion goes all out of order and all of that. If we didn't look at that emotional point of us being stressed as causing the physical elements, all we would ever do is address the physical responses to stress and never address the emotional issues. So what homeopathy seeks to do is it treats the whole mind, body, and emotional state. When we look at conventional medicine principles, and it does have its place. I mean, if I go and break my arm or I get a leg, severely lacerated or that type of thing, give me a trauma surgeon, not a homeopathic doctor, because I need immediate type of attention that requires trauma care. Typical, though, when we're looking at a diseased state, and means dis-ease, that means the body is not in its normal healthy state. Medicine looks at things more as the symptoms and what can we do to reduce the symptoms. For example, cholesterol. Okay, we're going to lower your cholesterol, and there's very little data that says cholesterol in and of itself contributes to death. As a matter of fact, the lack of cholesterol can contribute to vascular breakages and all that. But the point being is we'll develop drugs, for example, in this case, statin drugs, to treat cholesterol, without addressing, hey, this person may have vascular inflammation, they may have high blood sugars that are causing this. So oftentimes, we'll just throw them on a cholesterol-lowering drug in combination with a whole bunch of other medications to treat symptoms, without addressing diet, emotional state, a lot of different factors. So that's conventional medicine as we know it. It can be harmful because the majority of drugs come with side effects. There's very few of them out there that don't. And so rather than stimulating the body's own natural responses to deal with situations, modern medicine seeks to just stop the symptoms and not enable the own natural processes to take place. So, and once again too, when we're talking as in, for example, the stress issue I gave as an example, The modern medicine only considers the physical. Very rarely does it consider the emotional or the mental state of the individual, which can be the main cause of the dis-ease, the body being out of balance. When you think about disease, I want you to think in terms more of the body not being in balance. So if I get a cold, or if I get some type of infection, there's a reason, for some reason, my body is out of balance to where my immune system isn't reacting and responding properly. And necessarily to throw me on an antibiotic may not be the best way unless I've got a raging bacterial infection. Oftentimes we'll see antibiotics prescribed for viral infections, which as a preventative, and we've discussed that a couple of shows ago, and that's not a good idea. But the point being is different philosophies addressing. Now, these two are not mutually exclusive. We can have good allopathic medicine, naturopathic medicine, with a little bit of help from homeopathy. And probably the best examples I can give of that would be plastic surgeons. We have plastic surgeons, Dr. Gross, a lot of other plastic surgeons, even a local ear, nose, and throat doctor that's recommending the use of a homeopathic called Arnica montana. And what this Arnica does is when you take it a couple of days before surgery and post-op, it really prevents swelling and bruising. And it's basically, and I'll go into what a homeopathy or what the medicines are, but basically you take it those few days and you'll see a reduction in how the body reacts and responds to the trauma. We get a lot of cases where we get that green slime coming from the nose, and it's due to allergy responses, and there's appropriate homeopathics that work for that. It's kind of funny, there's a leg cramp formula, and other than being a little mineral deficient, maybe electrolyte deficient, that's got a little bit of homeopathy with a little quinine, and it's one of the most effective homeopathic drugs I've seen. And I should say homeopathic medicine, because once again, unlike standard drugs, we don't get any side effects. Homeopathy is very safe to take with all other medications. I mean, I've never seen, under any circumstances, nor reported, anybody ever reacting to homeopathy or homeopathic medicines. Now also too, remember months and months ago when we talked about the flus that were going around, particularly the swine flu and the 1918 flu? Remember how I told you that over 90% of people that had the 1918 deadly flu, when they used homeopathic medicines, and actually in homeopathic hospitals they had 0 deaths, because they would stimulate the body's own natural response to deal with the flu versus trying to kill it off and watch side effects happen as we tried to do here with modern medicine. So very effective, and I think the 1918 flu is probably the best example of success of homeopathy being nearly 100% versus medical science only being between 65 and 70%. So, as I noted, safest known to man as far as treatments with no side effects. Now, the sources of homeopathy come from plants, animals, minerals, all those types of organic and inorganic substances, but they're not chemical based. They're all what we would term as being natural forms. Even snake venom, believe it or not, for certain things. Things you would normally see as a poisonous plant, that if it's diluted to a certain point becomes a stimulating factor in the body to help the body heal itself. I kind of thought it was important for you to understand how these types of medicines are prepared so that you have an understanding in how they work. And they almost work on the theory of kind of like vaccines, only without giving you the actual germ or virus or bacteria itself. What they do is they actually grind the active ingredient, whatever it is, whether it's a plant or animal or mineral, and then they dilute it. They seep it and they dilute it. And the more they dilute it, the belief is the stronger the actual components are in its ability to stimulate the body. So, for example, if I were to add 9 parts alcohol, shake it 10 times, and then do that again, it would be called a 2x. So every time it's diluted to a 9 times dilution, it goes progressively up in what was considered its strength. There's different types of measurements. When you look at homeopathy, sometimes you'll see the X's and you'll see the C's and you'll see the M's. And the biggest difference is the ratio is 99 on the C's instead of 9 on how much further they reduce it. There's liquid homeopathics. There's very easily to melt ones that we use a lot. Like, for example, I used a bedwetting formula with one of my sons that was about 50% effective, homeopathy, that was very helpful, that would immediately melt under his tongue before he went to bed. It was safe and it was effective. Once again, and I didn't have to worry whether or not he was going to react in the middle of the night. Like I said, they come in pellets, tablets, liquids. You'll see all different types, and I know in the stores that my husband and I have, we have an entire section just devoted to homeopathics for allergies, molds, anything. And I can't believe I have physicians, nurses, and all that come in, and these do work. It's very helpful, however, to know what the person's emotional state is as well, too. And in order to get the proper homeopathic measurements when you're dealing with something that's very complicated, you truly need to have a homeopathic doctor that can help you go through what a person's emotional state is, where's their mental state, what's the precise, are they sensitive to hot or cold. It's very, 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 very intricate. Otherwise, whereas you'll come in with a runny nose to your doctor and say, okay, you've got a cold. In homeopathy, they're going to ask you what color is the discharge from your nasal passages. Does he have a fever? No fever? Does he feel better when he's hot, cold? Is he anxious? All these questions go into play in order to determine what the proper homeopathic medicine would be in these more complicated issues. So it's a very precise medicine that's very detailed and can be very helpful. You can do more research about it online to get more information. I just wanted to give you just a basic idea of what it's about and how very safe it is, and to kind of inform medical people as well that it can be used as an adjunct to other medications to help with other symptoms. They're always taken on an empty stomach, preferably, and they melt or sit in the tongue for absorption. The mouth absorbs everything, so as you're chewing your chemical-based gums or whatever you're chewing full of chemical pesticides, remember, the mouth, it absorbs everything. So through this medicine, particularly when you don't have any food saliva inducement, it absorbs really, really readily into the bloodstream. I've written down a standard that you want to look at when you're looking at the dosages that you tend to want to use. And generally, as far as the strengths, you're going to look at 6C or 12C or 12X or 6X when you're talking about acute conditions. Those are things that are not chronic. I think just simple, fast types of things, like we'll do an arnica 12C just for a simple bruise, but if someone's going to do surgery where they've had trauma, we'll usually send them in with a 30X or a 30C because we're going to have a longer period of time someone's going to potentially experience symptoms having to do with recovery from surgery. So once again, when you look at this, we're looking at more the organ-based types of issues that we're talking about. Whereas when we get further down in strengths, it starts considering the nervous system. Is it a chronic issue? If it's a chronic issue or involves the nervous system, we're going to go stronger. If we've got emotions and all of that involved, then we're going to go stronger yet. And these are actually custom-made types of medications. I'll have customers come in and say, okay, I want 200 C's of Nexvomica, and I'm like going, okay, and I special order it. Now, mind you, what's really interesting about these medications, too, is they're extremely inexpensive. You're talking $7 and something to get something that will truly aid and abet whatever you're taking from your doctor or your other healthcare professional, or researching on your own. I've written dosages down here standardly. Now, obviously, if you have a homeopathic doctor, you may do things differently, or he may tell you, hey, I want you to take 10 of these or 12 of these every 4 hours or whatever, because obviously, based upon the judgment that he or she may make, you may require more. But standardly, these are the dosages that are meant to be taken, obviously less for children. I think it's worthwhile to further research this, take a peek at it, and honestly see whether or not it can be an adjunct to what you're doing right now. I know a lot of companies will actually post on there some of the symptoms that it will treat on homeopathy or on the actual bottles, and that's legal. because homeopathy obviously has been around before the AMA. It's been a medicine that's been around for a very, very long time. So there's a lot of proof and a lot of evidence on how these do work. And I think as people use them, and I use them quite often, you find the effectiveness of them. I mean, like for example, there's one that helps strengthen the teeth. It's a calciflora. Calcium is always the antidote for fluoride, and calciflora in a homeopathic form, I've seen kids' teeth that were literally crumbling within about 6 months to a year. The progression slows and they're able to absorb their calcium, magnesium at a much better rate. So medicines to check out, very safe, effective, obviously for things that are non-trauma related. Next, we're going to be moving on to the fitness portion of our show, and we're going to show you a cool yoga move. Thank you very much. Welcome to the fitness portion of our show, and today we're going to do a little bit more complex yoga kind of Pilates move called the seated eagle. Now this is more advanced and it is a little bit more difficult, but you can try modified parts of it and see what you can accomplish with your own body structure. I tend to not be very flexible, so these are a little bit harder for me, but they're excellent for stretching the tendon and ligaments. And what you do, and if you want to, you can hold on to something behind you. You bring your left leg across and round about to your right. So you kind of get steady, keeping your posture really good. You bring your hands up and you kind of hold this position. Now when my balance is better here, I'm going to have a comedy act here, aren't I? And you hold this position for balance as best that you can. Now, the proper way to do this is when you wrap it around, we call this the seated buzzard. If you're like this and it's all bent over, so the key is we want to hold the body nice and tight and strong and control the breathing. See, I'm talking here, so it's a little harder to control the breathing. But this position will stretch and help the tendon and ligaments and help you with your balance as well. Now be sure to switch the legs around and get in. I mean, if you can only do a partial, like something like this, where maybe you're bringing it across, that would be okay too, because see what I'm doing here is I'm still balancing on one leg. If you want to finish it off, you can do the tree, where you bring your leg up and you just kind of down, around, and bring balance. The key is I want you to get on your one foot and try and balance yourself as best you can. Balance is very important, particularly as we grow older. Now, next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today with his knowledge and information is Ralph.
And thank you very much for the intro.
Sure.
Now, first to start off with is about the FDA. Now, I normally try to stay away from being political and stick more with the knowledge-based stuff or the pharmaceutical. However, the Food and Drug Administration came up with a very interesting ruling in regards to the battles of our access to raw milk. Now, not so much the decision they made against or in favor of raw milk, but their position on just about everything in regards to the Food and Drug Administration's belief in power and control. Now, first of all, the FDA contended that basically you, I, or we have no right to natural food. This came out of the Farm to Consumer Legal Defense Fund, otherwise known as the FTC-LDF. What they did is they filed a lawsuit against the interstate ban on selling raw milk. Nevertheless, this suit led to a surprisingly cold response from the FDA. I'm also going to pull a little bit from the Natural News, which also reported on this article. This isn't quote unquote, this is from the Natural News. Well, the FDA essentially believes that nobody has the right to choose what to eat or to drink. You're only allowed to eat or drink what the FDA gives you permission to. There is no inherent right or God nor constitutional right given to consume any food from nature without the FDA's consent. Now keep in mind, we want to emphasize the word nature. Apples, cherries, peanuts, apricots, you name it. Not something that's been chemically modified and put into a bar form like a candy bar or something like that. You have no natural right to food. Now, the FTC LDL, the Farm to Consumer Legal Defense Fund, pulled this excerpt from basically the FDA's ruling, or basically a letter to the court in regards to transferring or basically using raw milk across state lines. And this is where it gets surprising. First statement on page 26 from this ruling. There is no, and remember emphasize the word no, deeply rooted historical tradition of unfettered access to foods of all kinds. Then to follow, plaintiff's assertion of a, now remember this first part really well, because it leads into other things too. Plaintiff's assertion of a fundamental right to their own bodily and physical health. I'm going to stop that part there before I go to the rest of the quote. The reason being fundamental right to their own bodily and physical health is, for example, fluoridation and medication of your water supply, mandatory vaccinations against your will. So certain type of medical treatments and things that the government allows themselves to do to you, regardless of constitutional protections. And I'll finish the rest out, which includes what foods they do and do not choose to consume for themselves and their families, is similarly unavailing because plaintiffs, remember these are people trying to sell milk, do not have a fundamental right to obtain any food they want. Now to read it unobstructed. Plaintiff's assertion of a fundamental right to their own bodily and physical health, which includes what foods they do and do not choose to consume for themselves and their families, is similarly unavailing because plaintiffs do not have a fundamental right to obtain any food they want. That is the FDA speaking. That has been non-altered. That is the words verbatim. It believes it has the total authority to decide what you or I or anybody else in the United States can and cannot eat. And furthermore, to follow up a discussion of raw milk, you're like the statement from the FDA's director in regards to plant and dairy foods safety, John Sheehan. He says, quote unquote, and just said it a couple of days ago, raw milk is inherently dangerous. It should not be consumed by anyone at any time for any reason, says John Sheehan, director of the FDA's Division of Plant and Dairy Food Safety. Well, I think John Sheehan needs a little bit of re-education because most of you have grandparents, great-grandparents, so on and so forth, and many of you today that live off of raw milk without any major outbreaks of contamination of Salmonella E. coli or whatever. Generally, basically, he made that statement based upon no scientific merit, just pure power, and I doubt that it's ignorance, but just pure power and his authority. What I really encourage you to do, to follow this thing through all the way through, is go to ftcldf.org. F, T as in Tom, C as in cat, L, D as in David, F.org, the Farm to Consumer Legal Defense Fund, which will give you more information in regards to these battles with the Food and Drug Administration. Now, on to some good news. I really got to give these guys credit to Johns Hopkins. Johns Hopkins is making some very progressive studies, especially in regards to epileptic, or I should say seizures, from children. Well, Johns Hopkins Children's Center for Study published online in the Journal of Epilepsy came out with some interesting studies in this regards to infant seizures, also called West syndrome. They often know that drugs do not make West syndrome better for infants. In fact, have very little impact at all. But what they've been doing is really been very, very innovative. They've, for the longest period of time, been using what's called the ketogenic diet. Now, you remember keto from basically the old Atkins days. What it basically means is low carbohydrate. They say, in their own words, that the ketogenic diet, made up of high-fat foods and few carbohydrates, works by triggering biochemical changes that eliminate seizure-causing short circuits in the brain signaling system. It has been used successfully in several forms of epilepsy. How successfully? Well, let's give you a little idea. Let's look at the data from Johns Hopkins. Of the 104 children treated by the Hopkins team, nearly 40%, or 38 children, became seizure-free at least 6 months after being on the diet. Remember, they had no seizures for 6 months after being on diet for guess how long? Just a few days. Of the 38, 30 have remained so without a relapse for 2 years. That means 30 kids out of 104, just from being on the diet just for a couple of days, did not have a seizure relapse for over 2 years. They also said, after 3 months on the diet, now these are people that continued, 1/3 of the children of the 104 had 90% fewer seizures. After 9 months on the diet, nearly half the 104 children had 90% fewer seizures also. And following through that, nearly 2/3 had half as many seizures after 6 months on the diet. You're talking about 75% of the children on this diet where drugs had no impact, had 90% fewer seizures. You got to give Johns Hopkins a lot of credit for this. And they're beginning to recommend it as being a first line of treatment for children. If it works, do it. If you have an infant that has seizures, or what I call West syndrome, definitely either get a hold of these guys or inform your doctor and say, hey, let's not try the medication first. Let's just try changing the simple foods around. And now, following the thyroid. Now, this is in the archives of otolaryngology, the head and neck surgery of one of JMAA archive journals. Real interesting thing. Most patients survive common thyroid cancer regardless of treatment, meaning no treatment. They say studies published as early as 1947 demonstrated it, and more recently, a report has shown that nearly every thyroid gland might be found to have cancer if examined closely enough. What that means is most everybody has something that can be diagnosed as thyroid cancer to start with. So the more you look for it, the more you're going to find it. So chances are, if you really want to look for cancer in somebody, especially thyroid, you're almost 100% certain you're going to find cancer. Now here's what they discovered. The people that were not treated for thyroid cancer, but supposedly were diagnosed having it, 97% had a survival rate past 20 years easily. Of those treated for thyroid cancer, still better improvement, but 99%. And this again, this is the JAMA archives as of March 17th. So something to look at for if you want to basically go into it a little bit more in detail. And I apologize, it's actually May 17th. All right, now here's something else. We all know eating processed foods is bad for us, but how bad? Well, the Harvard School of Public Health, guess what? Just eating 50 grams of processed meat per day. 50 grams being one hot dog, just one hot dog. And they followed 1,200,000 plus people. Eating one processed hot dog per day raised your risk of developing heart disease by 42% and your chance of diabetes by 19%. 50 grams. Eating the unprocessed meat, zero impact as being negative diabetes or heart disease. Just something to finish up with. Well, thank you very much.
Yeah, thank you very much, Ralph. Always appreciate the information. Once again, do your research, look up for yourself, be informed. Thank you very much for joining our show. Have a good day.